I've seen it on a number of occasions. We don't have that many Tourette's patients per se, but we have a handful of patients and we see them on a repeated basis. They tend to come back in over and over and over again, and a lot of times they'll be doing well and then they'll have little flare-ups and subsequently they'll need to go ahead and get treated. But we work in concert with the psychiatrist. A lot of times the psychiatrists will be the ones who are managing their medications. First step I would take is I would go ahead and send them off to the psychiatrist. The psychiatrist is really, as far as treatment for Tourette's, I mean, first of all, you have to go ahead and make the diagnosis. So if someone comes in with Tourette's, a lot of times they will have had preceding tics. These can be simple motor tics or more complex motor tics. They may also have some voice tics, so to speak, verbal tics. They may have coprolalia, where they're saying bad words over and over again, or they may have echolalia, where they're just repeating and repeating and repeating words. It may be just a simple word or phrases. If you suspect somebody does have Tourette's, the person who usually manages that would more be the psychiatrist. The medications that are used for Tourette's would be Haldol or Clonidine. Haldol has a certain amount of side effects that you can go ahead and get. You can get tardive dyskinesia with Haldol. Clonidine does not have as many side effects, but may not be as effective. Other alternative treatments for Tourette's, I have not seen a lot of success with. Now, that doesn't mean that it doesn't work. I'm going to have a biased sample, so to speak. If someone has Tourette's and they have tried other alternative medications for Tourette's, I wouldn't necessarily see them. They're getting the results that they want.
Summer going into the 6th grade, and yeah, like certain medicines actually work. Like I've had to go off like 5 or 6 different ones, but I found some that work. Well, at this point, I pretty much don't notice it at all because it's become so much of a habit for like 5 years. I don't notice it really. So. Mainly doing stuff like this and having to explain it to people, because for me it's not that hard at all. I'm used to it, but it's mainly when people ask me about it. I have to think of stuff to say because it's pretty much part of me, so I don't really notice. But